Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number first. Father of medicine is option A Hippocrates, options B Aristotle, option C Claudius Galen, options D Cornelius Celsus. The right answer is option A, that is Hippocrates. Okay. The father of medicine is Hippocrates, while father of veterinary medicine is Renatius Vegetius. Okay, and if you see that father of zoology is Aristotle, and that Cornelius Celsus is the one who gave the cardinal sign of inflammations, and that antemortem examinations was first conducted by Claudius Galen, while that beginner of modern pathology is G.V. Morgagni, and if we see that father of histology who divided that body tissue into 221 group, that is MFX Bichet. And if we see that father of cellular pathology is Rudolf Virchow, and that first experimental pathologist is John Hunter. Okay, that Carl's Rocky Teniski is the one who established necropsy techniques and considered as supreme descriptive pathologist. And if we see that father of microbiology is Louis Pasteur, father of bacteriology is Robert Koch, and that Julius Cohnheim is the one who is the originator of modern experimental pathology. Negri is the one who described intracellular inclusion body. Knoll and Ruska invent electron microscope. Theobald Smith can demonstrate that arthropod can also act as a vector of many diseases. If we see that father of pathology is Antonio Venevini, and Ili Machnikov is the one who discovered a phagocytosis process, and father of immunology, that is Edward Jenner. Okay. Question number second, how many elements and humors that Hippocrates used? Okay. Options A, 2 elements and 2 humors. Options B, 4 elements and 2 humors. Option C, 4 elements and 4 humors. Options D, both B and C. The right answer is option C, that is 4 elements and 4 humor. Okay. That's Hippocrates belief that the body was made up of 4 major component, or that we can see 4 humors. Okay, and these 4 humors should be remains in balance in order for that people to become healthy. Okay, and these 4 humors was present in a form of liquid within a body, that is a blood, phlegm, yellow bile and black bile. And these 4 humors are connected with 4 elements, that is air, water, fire and earth. Okay, that blood, the source of blood is that heart is a source of blood, and it represents a moist and warm like air. Okay, and phlegm, brain is the source of phlegm, which represent that moist and cold like water. Okay, liver is the source of yellow bile, which is a dry and hot like fire. Okay, and spleen is a source of black bile, which is dry and cold like earth. Okay. Questions number third. First vet college was established in. Okay. Options A, established in Lyon, France on January 1st, 1762. Options B, in France on February 2, 1872. Option C, in India on Jan 6, 1773. Or options D, in USA on Jan 4, 1875. The right answer is option A, that is in Lyon, France on Jan 1st, 1762. Okay. Claude Bourguilet, who is the man who is renowned for his skill in horsemanship, and who is known for his that horse medicine. He founded that first veterinary school in Lyon, France on January 1st, 1762. Okay. Questions number 4. Bulging muscles of a race horse are example of option A, cellular injury, options B, necrosis, option C, cellular adaptations, or options D, gangrene. The right answer is option C, that is cellular adaptations. Okay. Bulging muscles, that is a hypertrophy of a race horse, is an example of a cellular adaptations. If we see that when a cell is that like injured or subjective to the pressure, one of the two pattern will generally result. First is that cells tend to adapt to that pressures. When cells to adapt to that injury or that pressure, their adaptive changes can take place. That adaptive changes can be like there's atrophy of that cells, or that hypertrophy and hyperplasia or metaplasia take place. And if that adoptions doesn't take place, or that adoption fail, at the time degenerative or retrogressive changes take place, that is known as cellular injury. And cellular injury can be that reversible type, which can be leading to adoption of the cells and tissue, or irreversible types, which is lead to the cell death or tissue damage. Okay, and if we see that development steps in development of lesions in cellular injury, that first there is a biochemical lesions take place, and then ultrastructural changes take place, and then gross lesions take place, and finally there's a microscopic lesions take place. And that consequences of cell injury, that how large that cell injury take place, it's depend upon two factors. First is like the type of the stimulus and duration at which that stimulus take place, and the severity of the stimulus. Second is that the adaptability of the cells, type and states and adaptability of the cells. Okay, questions number 5. Loss of blood cause death of option A, neuron within 3 to 5 minutes. Options B, myocardium, hepatocytes, renal epithelium within 30 minutes to 2 hours. And option C, that is fibroblast, epidermis and skeletal muscles after many hours. Options D, all. The right answer is options D, that is all. Okay, loss of blood causes that death of a neuron. If the neurons are deprived of blood, then neuron died within 3 to 5 minutes. And if there is a heart, that is myocardium, hepatocytes and renal epithelium, if they are deprived of the blood, they died within 30 minutes to 2 hours. And while death of a fibroblast and skeletal muscles and epidermis take place after many hours. Okay, questions number that is a 6. In H and E stain, hydropic degenerated a vesicles take which color? Options A, blue color because of a protein. Options B, blue color due to that carbohydrate. Option C, pink color due to that carbohydrate. Or options D, pink color due to protein. The right answer is options D, that is a pink color due to that protein. In H, that is hematoxylin and eosin stain, that hydropic degenerated vesicles, that is a vesicles which contain that fluid, that watery fluid, which takes actually that while staining with hematoxylin and eosin stain, they takes a pink color due to that presence of a protein. While mucin is like a glycoprotein which is mainly constituted of mucus. When we stain with that hematoxylin and that eosin stain, they take blue color, while pseudomucins also take pink color. Okay, questions number 7. That is amyloids infiltrations or waxy degenerations occurs in option C, between the cells. Options B, within a cells. Option C, between and within a cells. Options D, none. The right answer is options A, that is between the cells. Okay, amyloids or waxy infiltrations, that is known as like amyloids, especially when that large proteins break down, that leads to form that amyloids as another types of proteinous structures. That's infiltrations occurs in between the cells, and while hyaline, fat and glycogens collects within a cells. Okay, let's see some other facts related to amyloids infiltrations. That is amyloidosis actually is the cause due to that antigen antibody reactions, that is hyperglobinemia, when there's a hyperglobin amount is high in that blood. Okay, and amyloids deposits around that blood vessels and in also that connective tissue. If we see that amyloids infiltrations example, that is we can see that backbone spleen, and that is our another is that sago-spleen. Okay, a backbone spleen is a diffuse amyloidosis where there is a amyloid substance is deposited in both like white and red pulp, that's around central arterioles and splenic sinusoids, while a sago-spleen is known as focal amyloidosis. Okay, where amyloid substance only deposits in white pulp only. Okay, and if we stain that the cells with amyloid infiltrated with iodine, that gives a mahogany brown color due to amyloids, while after that the iodine stains will be followed by that 1% weaker sulfuric acids, it gives black or blue color to that amyloid infiltrated cells. And if we that stain that amyloid infiltrated cells with Congo reds, it's give red color to that amyloids. And if we that stain that amyloid infiltrated cells with methyl violet, it gives a rose red color to that amyloid infiltrated, and that surrounding tissue give blue color. Okay, and note, if we know that the extent at which that amyloid infiltrated take place, we should that inject Congo red dyed IV intravenously, and we can identify the extent of amyloidosis. Okay, questions number that is 8. In which degenerations extracellular component of cells are transformed into glassy appearance, and it is translucent and more acidophilic? Options A, fibrinoids. Options B, gout. Option C, hyaline. Options D, glycogen's infiltration. The right answer is options C, that is a hyaline. Okay, In hyaline degenerations, that extracellular component of cells is transformed into that glassy appearance, and it is translucent and more acidophilic. Okay, while in case of like Jenker degenerations of rectus abdominis muscles in a human, in case of human typhoids or equine azoturia, white muscles disease and stiff limb disease are also an example of hyaline degenerations. Okay, an example of that connective tissue hyaline degeneration is arteriosclerosis and scar tissue, while example of epithelial tissue that hyaline degeneration is a corpora amyloidosa. Corpora amyloidosa is a general term for small hyaline masses found in that prostate gland, nervous systems, lungs, and sometimes in other organ of a body, and hyperkeratosis. In if hyaline degenerations that take place in hepatitis in prisons, such types of that granules known as councilman's bodies. In hyaline degenerations that the take place in plasma cells myeloma, that's types of granules known as Russell's bodies. In hyaline degenerations presence in cirrhosis, in case of liver cirrhosis, that types of bodies known as Mallory body. Okay, questions number that is a 9. Okay, mucin takes which color with H and E stain? Options A purplish red, options B blue, options C pink, options D all. The right answer is options B, that is blue color. Okay, mucin is a glycoprotein which is mainly constitute of mucus, and this mucin when stained with that H and hematoxylins and eosin stains, it takes a blue color. We already discussed that hematoxylins and eosin stains is used to identify the nature of the which is mainly used to stain the cells in order during that biopsy. Mucins take a blue color with hematoxylin and eosin stain, while mucin take a purplish red color with that periodic acid stiff stain. Okay, mucin also take blue color with Alcian blue dyes, and while pseudomucin, which is mainly seen in case of like a cyst adenoma of ovary, it's take pink color with H and E stain. Okay, questions number 10. In which degenerations crystals of uric acids or urate of calcium and uric of calciums and sodiums are deposited in the tissue? Option C, that is amyloidosis. Options B, myxomatous degenerations. Option C, gout. Option D, fibrinoids degenerations. The right answer is option C, that is a gout. Okay, in gout, crystals of uric acids or urates of sodium and calciums are deposited in the tissue. Okay, aquatic animals are aminotelic. They excrete ammonia in the form of ammonia, while mammals are ureotelic. That is, mammals excretes like nitrogen waste in the form of urea, while birds are uricotelics. Like birds excrete nitrogen waste in the form of uric acid. Okay, now birds in also in case of Dalmatian's dog also excrete out uric acid in large quantity due to the presence of uricase enzymes. Okay, and if you see that's gout, where there is a crystals of uric acids or urate of sodiums and calcium salts are deposited in that tissue. That's gouts occurs in all birds, apes, and men, which drinking large amount of beer and red wine. Okay, in birds, if we see that's a gout, that uric acid depositions take place in that articular form, and also in the visceral form. That's uric acids crystals deposited in that joint, and as well as in that visceral organs. Okay, while in human, that gouts take place in two forms, that's primary form and secondary form. Primary form is like when gout, which is a familial and hereditary, and occurs due to that when there is a uric acids is high in blood due to metabolic defect in that purine metabolisms. And while secondary gout is that gout which is occurred due to the overproductions of uric acids, as is we seen in this polycythemia, hemolytic anemia, and leukemia extra. Okay, questions number 11, that is in glycogen's infiltrations with H and E stain, it appears empty vesicles due to options A, glycogen does not take stain with H and E. Options B, glycogen is removed during preparation of sections. Option C, no exact reason is there. Options D, all. The right answer is that options B, that is glycogen is removed during preparation of sections. In glycogen's infiltrations with H and E staining, it's appear like empty vesicles because that's glycogen is removed during that preparation of sections. NHN is staining that it stains only peripheral stains that blue because that glycogens appears in a nucleus and it pushes that nucleus to that periphery. Okay, while with best carmine stain, glycogens take light pink color. Okay, glycogens infiltrations mainly take place in organs like livers and kidney. Okay, questions number that is 12. Fat depot of body are options A briskets, bone marrow, subcutaneous, jowl of swine. Options B omentum, orbital fossa, mesentery. Option C perirenal, pericardial, subserosa. Options D all. The right answer is options D. That is all. Okay, fat depot of body where that fat stored are that briskets regions, bone marrow, and that subcutaneous regions, jowl of swine, omentum, orbital fossa, mesentery, perirenal regions, pericardial regions, subserosa, extra. Okay, the conditions in which due to that metabolic dearrangements large quantity of fat from that fat depot to that healthy cells of a liver, that's overloading of that fat accumulates in that healthy cells. That condition is known as fatty infiltrations, and the cause of fatty infiltrations that is a choline deficiency in liver and disturbance in fat metabolisms, while the conditions in which there is a mitochondrial damage take place and that enzymes of that fat metabolisms get disturbed. Okay, and while the conditions in which that disturbs and that fat accumulates and become visible, that is known as fat degenerations and fat phanerosis. Okay, fatty degenerations occurs in parenchymatous cells of liver, kidney, and heart. Okay, in fatty infiltrations, if we see that fatty infiltrations, one or two that large vacuoles are present in a cells, and the nucleus is that displays to the sides, while in fatty degenerations, that vacuoles is that smaller and nucleus is not displaced. Okay, a thrust breast heart or a tabby cat heart, which is mainly occurs in case of fatty degenerations. Okay, and fat is actually in fat depositions and actually demonstrated by frozen section technique and freezing microtom technique. Okay, fat takes yellow or orange color by that Sudan third, while a fat take that red color by Sudan fourth, that is scarlet red, while a fat take a black color by osmic acid. Okay, and in order that fat that is staining, that removal of fat, we will that during processing we use xylol, which remove fat during processing. Okay, questions number 13. That is a hyperemia, which is due to that arterial and arterial dilations produce an increased flow of blood into capillary bed, is known as option A, that is a active hyperemia. Options B, that is a passive hyperemia. Option C, that is a congestions. Option D, that is none. The right answer is option A, that is active hyperemia. That hyperemia in which due to that arterials and there is a arterioles dilations which produce increased flow of blood into that capillary bed, that is known as active hyperemia. And the causes of active hyperemia is that inflammation is a cause of active hyperemia. All active hyperemia, if we see, that is that acute in nature, that's acute, and that active hyperemia is best detected by a cardinal signs of inflammations. Okay, and hyperemia which is occurred due to that impaired venous blood flow, that's impaired drainage of that venous blood, that is known as passive hyperemia or that congestions. That if we see that passive hyperemia, it can be both, that is a acute and as well as chronic, and while but chronic is more common passive hyperemia. Okay, and if we see that's in general passive hyperemia, there's a general, in case of general passive hyperemia, that's interference in that venous drainage is actually central, that's either in a heart or in lungs, you know? While chronic passive hyperemia of lungs, which leads to that lungs, that leads to brown indurations of lungs, heart failure cells we've been seen in that lungs, and also it is seen due to that occur due to that either there's a mitral valve stenosis take place or that left side's heart failure. While cross chronic passive hyperemia of liver, which leads to cause liver that nutmeg pattern of liver, and then cardiac cirrhosis of livers, and which is mainly occurs when there is a tricuspid valve stenosis take place or there is a right side's heart failure take place. Okay, while in hypostatic congestions, there is a disturbance of a circulations. There is a sluggish circulation. That circulations become very slow, which lead to that accumulations of blood in that ventral part of the body due to that influence of the gravity. Okay, hypostatic congestions occur at the time of death, that is known as agonal congestions, while hypostatics occurs after that is known as postmortem congestions. Okay, in postmortem hypostatic congestions, fluid is not frothy, while in antemortem hypostatics or that agonal hypostatic congestions, fluid is frothy. Okay, and the complicating changes of hypostatic congestions include like edema, inflammations, hemorrhage, and necrosis extra. Okay, uh, questions number 14. The size of petechial hemorrhage are which? Options A, less than 1 mm in diameter. Options B, over 1 to 2 centimeter in diameter. Option C, approximately 1 centimeter in diameter. Or options D, diffuse fat, irregular area of bleeding. The right answer is option A, that is a less than 1 mm in diameter. The size of petechial, or that is a pinpoint hemorrhage, is less than 1 mm in diameter. Okay, and that hemorrhage is called suffusions when there is a diffuse flat irregular area of bleeding. Okay, and hemorrhage is called purpura hemorrhage, which has the size of approximately 1 centimeter in diameter, and size of ecchymotic hemorrhage is over 1 to 2 centimeter in diameter. Okay, questions number 15. Formation of a thrombus involve interactions of options A, blood vessels wall, options B, platelet, option C, blood clotting systems, options D, all. The right answer is options D, that is all. Okay. The formation of a thrombus that's involve interactions of all. That is first is like blood vessels wall, second is platelets, and then blood clotting systems, while formation of a blood clot only involved like there is that blood clotting systems only. Okay, although that thrombus is also a type of a blood clot, but it occurs inside that arteries and vein, and it is a pathological conditions, and that blood clot is actually life saving while thrombus is a life threatening conditions. And the main component of thrombus is platelet, while main component for blood clot is fibrin. Okay, let's see some other facts related to thrombus. That is a thrombus is actually seen in that vein where there is a slow circulations take place, and vegetative endocarditis occurs in vegetative types of valvular thrombi. Okay, types of cardiac thrombi is actually valvular thrombi, which is mainly seen in swine erysipelas case and which is attached to the valve. Mural thrombi, which is attached to the wall and common in cattle, which is suffer with BQ, that is a black water. Ball thrombi, which is uncommon and almost seen in that setting of mitral valve disease. Okay, in a horse, thrombi is common in like anterior mesenteric artery due to that Strongylos vulgaris larva, while venous thrombi in animal observed in nasals, vascular sinus of cow and horse, vein of broad ligament of cow, scrotal plexus of horse extra, while venous thrombus in man are common in femoral, popliteals, and iliac vein extra. Okay. Questions number 16. Thrombi which attach to one side of a vessels is known as options A, canalized thrombi, options B, occluding thrombi, option C, saddle thrombi, options D, lateral thrombi. The right answer is options D, that is a lateral thrombi. Thrombi which attach to the one sides of the vessels, that is known as lateral thrombi. Okay, the thrombi which attach to that circumference, entire circumference of that blood vessels, that is known as that's occluding thrombi. Thrombi which occurs on that bifurcations of that blood vessels, that is known as saddle thrombi. Okay, thrombi in which that new blood channel has been formed through that clot, that is known as canalized thrombi. And the septic thrombi are those thrombi which contain bacteria, while aseptic thrombi are those thrombi which doesn't contain bacteria. Okay, let's see some example of a parasitic thrombi, that is a Dirofilaria immitis in case of dog and Strongylos vulgaris in case of horse. Okay, thrombi which is entirely composed of a platelets and observed in heart and blood vessels, that is known as a white thrombus. And the thrombi which also composed of platelets and fibrin and RBC and WBC, more RBC that's observed in vein, that is known as red thrombi. Okay, most common type of thrombi, that is a mixed thrombi, which is consist of both, that is a portion of both, that is a red thrombi and that the pale thrombi. Okay, white thrombi. Okay, white portions form when blood flow is rapid, and that red portion is formed when the blood flow is slow. Okay, type of mixed thrombus actually composed of that alternating red layer and that white layer, that is known as laminated thrombus. Okay, lungs is actually a fibrinolytic organs. In the lungs, thrombi form due to that platelets and leukocytes. Okay, note, there's a one note, that is thrombus can cause aneurysms. Aneurysms is a condition where there is a bulge occurs in a blood vessels due to that weakness in blood vessels. The main cause of that aneurysms is that's atherosclerosis, and where there's a high blood pressures, but thrombosis can also cause aneurysms. Okay, the cause of thrombus is inflammations. In case of thrombophlebitis, thrombophlebitis is that the thrombus which lead to the inflammations of the vein. Okay, while phlebothrombosis, the cause of thrombus is stasis and the size of the primary thrombus. In phlebothrombosis there is no that inflammations of that vein. Okay. Okay. Questions number 17. Type of postmortem clot are option C, red or currant jelly clot, options B, edema, option C, yellow or chicken fat clot, options D, both A and C. The right answer is options D, that is both A and C. Okay. Type of postmortem clots are that's red or currant jelly clot. That's a clots in which there's a component of a blood are that evenly distributed. Okay, and yellow or chicken fat clot, that is a clot in which component of blood are not evenly distributed. Okay. Questions number 18. In domestic animal, emboli always occurs in options A, that is artery, options B, that is vein, option C, that is a heart, options D, that is all. The right answer is options A, that is artery. Okay. Since like the thrombus is a type of that blood clot which is occurs within a that vein and blood vessels. Okay, na? And that blood clot when that separate from that vessels and then start to move within a blood vessels, such conditions is known as emboli. Okay, and this embolis is always occurs in artery in domestic animal, and embolis always lodges in arteries and capillaries because the diameter of these vessels are progressively decreases. Okay, in human, that venous embolism arises from thrombi within a vein of leg. Okay, when that venous embolism passes through that right side of the heart and lodges in a pulmonary circulation, then it is known as pulmonary embolism. While when that this venous emboli passes through that left sides of a heart and lodges in that systemic circulation, that is known as paradoxical embolisms. Okay. Fat emboli is that found in lungs from fatty marrow when that fractures of the long bone take place at the time that fatty marrows move toward that the lungs and lead to the cause embolisms in lungs. Okay, firm fat is less likely to cause emboli, while soft fat is more likely to cause emboli. Okay, nitrogen gas is responsible for gas or air emboli. Okay, embolus when that occurs in abundant blood supply organs like liver, it cause that less injury, but embolence when occurs lodges in that the organ which having no abundant blood supply as like in heart, kidney and spleen, it causes more injury, that's death of that area too. Okay. Questions number 19. In infractions from where necrosis starts and extend. Okay. Option C, start at center within 24 hours and extends to periphery within 72 hours. Options B, start at center within 72 hours and extends to periphery within 24 hours. Option C, start at periphery within 72 hours and extends to center within 24 hours. Options D, start at periphery within 24 hours and extends to center within 72 hours. The right answer is option A, that is a start at center and within 24 hours and extends to periphery within 72 hours. Okay. Actually, when that embolisms lodges to that the end arteries, it may cause that infractions, and infractions when there is infractions, there is a lack of that blood supply to that organs, and then necrosis take place. And this necrosis always start at a center within 24 hours of infractions, and that extend to that periphery of that organ within 72 hours. Okay. And solid compact organs like kidney, heart, spleen, that pale or white infract, that is known as also known as anemic infract occurs. These are referred as white because of lack of hemorrhagic and limited red blood cells and accumulate, while in loose spongy organs like lungs, red or hemorrhagic infractions occurs. Okay, red infractions due to the double blood supplies or double blood supply occurs in liver and lungs. Okay, note that red infract is common in intestine in horse too. Okay, infractions of kidney are common in that cow, pig, which is a wedge shape and found in cortex, and source of infraction is cardiac thrombi. This cardiac thrombosis is cause of infractions of a kidney and spleen. Arteriosclerosis is the cause of infractions of that brain and heart. Okay. Questions number 20. Excess accumulations of fluid interstitially, that is intercellular tissue space and in body cavity, known as option A, hypertrophy, options B, hyperplasia, option C, edema, options D, ischemia. The right answer is option C, that is the edema. Okay. Excess accumulations of fluid in that the intercellular tissue space and in body cavity, that is known as edema. Okay. Generalized soiling of that all subcutaneous tissue, that is known as anasarca, and edema in pericardial sac, pericardium, that is known as hydropericardium, edema in ventricle of a brain, that is known as hydrocephalus, edema in peritoneal cavity, that is known as ascites. Okay. Note that the Starling force means that fluid balance between intravascular and interstitial compartment is governed by actually like hydrostatics and osmotic pressures. Edema occurs when there is an increase hydrostatics and decrease osmotic pressures within a blood vessels. Okay. Most important cause of edema in animal, that is a most severe edema, and then cause of a parasitic edema, renal edema, nutritional or catalytic edema, that's a decreased osmotic pressure. While the important cause of edema in men, that's cardiac edema, that's increased hydrostatic pressure. Okay. Cause of local edema is actually a lymphatic obstructions, while the cause of generalized edema, that's a sodium retention. Okay. If we see that edematous parts where there is a fluid accumulates is we found that cold and also swollen, and there is an increased weight too, and there's a no pain in case of edematous parts, and colors become less intense than the normal. And when we there's a pressures that form a pit, and they stain pink with that eosin dyed because of that protein, and that edema also induce fibrosis. And edema of subcutaneous tissue is actually not fatal, but if that edema occurs in that brain and lungs, it can be fatal. Okay. Questions number 21st. Shock or vascular collapse occurs when? Options A, inadequate blood flow to cells. Options B, decrease in total blood volume. Option C, decrease cardiac output. Options D, all of above. The right answer is options D, that is all of above. Okay. Shock or vascular collapse occurs when there is inadequate blood flow to the cells, when there's a decrease in total blood volume and decrease in cardiac output. Okay. Let's we see that type of shock. Then we found that hypovolemic or cardiogenic shock, and decreased cardiac output and increased systemic vascular resistance. And second, that is anaphylactics and septic shock, where also we found there's a decreased cardiac output and decreased systemic vascular resistance. Third is neurogenic shock, where also we found that's decreased cardiac output and venous and arterial vasodilations. Okay. Let's see, there's a stages of shocks. Then there are three stages of shocks. First is that early or compensatory stage. Second is like progressive stage, and third is irreversible stage. Okay. And if we see that's blood pressures and heart rate, and then early and compensatory stage is near to that normal range. In case of progressive, that's heart rates and blood pressures it increases. And in case of irreversible stage, that require mechanical and pharmacological support. Okay. If we see that's respiration is that's near to normal in earlier compensatory stage. In case of progressive stage, that respiration becomes shallow, and in case of irreversible stage, it's require intubations. Okay. And if we see that skin color, that's a cold and clammy in early and compensatory stage of shock. That skin become molted and patechials we found in case of progressive stage of shocks, and that's a jaundice in case of irreversible stage of shock. Okay. And if we see that's urinary output, that is decrease in earlier compensatory stage of shocks, and progressive we found that 0.5 ml per kg per hour progressive stage of shock. And in case of irreversible stage, that's anuric, that's required dilations. Okay. And if we say that acid base balance, then the respiratory alkalosis take place in early stage of shock, and metabolic acidosis, that's a progressive stage of shock, and there's a profound acidosis in that irreversible stage of shock. Okay. Questions number 22. The size of cells in different species is which? Option A, depend upon the size of animal. Options B, it is species specific. Option C, same. Options D, any above. The right answer is option C, that is the same. Okay. The size of a cell in different species of animal is the same. The differences in the size of the two animals is only due to the differences in the total number of cells, but the size of the cell is same in all species. Okay. Questions number 23. Disturbance of growth are options A, congenital, options B, acquired, Options C, that is maybe congenital or acquired. Options D, none. The right answer is option C, that is a maybe congenitals or acquired. Okay. Uh, the right answer is option C, that is maybe congenitals or acquired. Okay. Congenital disturbance include that agenesis, aplasia, and hyperplasia. Aplasia is a condition when there's a complete failure of an organ or tissue to develop, and there's a bud is there. In case of agenesis, there is also complete failure of an organ or tissue to develop. Even bud is not there. Okay. Hyperplasia is that there's a increase in the size of an organs due to that increase in the number of cells. And while that acquired disturbance include atrophy, hypertrophy, hyperplasia, and metaplasia. Okay. Atrophy, there is a decrease in the size of that organs or that cells after it has attained their mature size. Okay. Hyperplasia is that cells never reach to their maximum size. Okay, full size. Hypertrophy, that is increase in a size of that organ due to that increase in size of a cells. And hyperplasia is increase in the size of an organ due to that increase in the number of a cells. Okay. Metaplasia is when there is a one type of cells is changed to that another type of cells. Okay. We see that's atrophy. Then we found that physiologic atrophic, senile atrophy, starvation atrophy, disuse atrophy, neurotropic atrophy, angiotropic atrophy, pressure atrophy, endocrine atrophy, and brown atrophy. Okay. Brown atrophy is that with the time that autophagic vacuoles increases in number and persist as a membrane-bound residuals body, that is a lipofuscins granules in cytoplasms, and that impart brown color to that tissue, that is known as brown atrophy. Okay. Questions number 24. Which organs are among the first to senile changes? Options A, respiratory. Options B, digestive. Option C, nervous. Options D, reproductive. The right answer is option D, that is reproductive. The organ first show that senile, that is aging changes, are reproductive organ. As organ ages, that ages pigment, that is lipofuscins deposited in organs. Okay. Questions number 25. Type of hypertrophy are options A, physiological, options B, adaptive, option C, compensatory, options D, all. The right answer is options D, all. The type of hypertrophy, that is a physiological hypertrophy, is that example of physiological hypertrophy, that is enlargement of uterus during that pregnancy, which involve both hypertrophy and hyperplasia. And adaptive, that is that enlargement of muscles of athletes, is an example of adaptive hypertrophy. Compensatory hypertrophy, that is the increase in the size of an organ or tissue when called upon or to do additional work or to perform the work of destroyed tissue or of the paired organ. Okay. A compensatory hypertrophy always seen that spared organ, that's like kidney, lungs, etc. And the central nervous systems never undergo hypertrophy. Okay. Questions number 26. The totipotential cells is which of the following? Options A, ovum. Options B, adult cells. Option C, embryonal cells. Options D, all. The right answer is options A, that is ovum. Let's see some different type of stem cells. Then we found four types of stem cells. First is totipotent, pluripotent, multipotent, and unipotent. Okay. Stem cells that gives all cells and tissue building organisms, and also that the extra embryonic structure too, that is known as a totipotents. Example of totipotent, that's ovum and zygote. Pluripotents are those stem cells that give all cells and tissue building organisms. Okay, but they doesn't give extra embryonic structures. Example of that pluripotent, that is epiblast cells. Multipotents are that those stem cells which presents in adult organisms give several types of cells. Example, hemopoietic stem cells which give like RBC, WBC, and the platelets, embryonal cells, etc. While unipotents are those types of stem cells which gives only one type of cells. Okay, adult cells, stellate cells in skeletal muscles. Okay, extra. Questions number 27. Which of the following statement is false? Option C, metaplasia is reversible change. Options B, metaplasia is irreversible change. Option C, one adult cells type is replaced by another adult cells type. Options D, transformations from less specialized to more specialized cell types. The right answer is options B, that is a metaplasia is irreversible change. Okay. Since that fact related to metaplasia, then metaplasia is actually a reversible change, as when a cause is removed, then metaplastic epithelium reverts to its original cell types, except in case of a bone and cartilage, which is a permanent alternations. Okay. And in case of a metaplasia, one adult cell types is changed into that another adult cell types, and there is a transformations of that less specialized cells type to that more specialized cells types. And for example, like transformations of cuboidal epitheliums to take place to that columnar epitheliums, and columnar epitheliums is transformed to that stratified squamous epitheliums, and fibrous connective tissue is transformed to like bone. Okay. Questions number 28. Which of the following is not an adaptive process? Option C, metaplasia. Options B, hyperplasia. Option C, dysplasia. Options D, hypertrophy. The right answer is option C, that is dysplasia. Okay. Dysplasia is actually a typical hyperplasia, is not an adaptive process in which that epithelial cells undergo proliferations and atypical cytological alterations, but not a neoplastic. Okay. When there is a change in when there is a change in which that's newly formed cells is more immature as compared to the original cells, such type of change is known as that is a anaplasia. Okay. Change of adult tissue to that other the tissues, but a label of differentiation shape, that is known as nomicoplasia. Example of nomicoplasia is like change of fibroblast into fibrocytes and fibrocytes to that fibroblast. Okay. That normal formation, that is euplasia. Repair, that is increased formation, is an example of proplasia. And degenerative necrosis, decreased formation, is an example of retroplasia. If content are accumulated and if these get compressed because of accumulations, then it is known as false metaplasia. Okay. Questions number 29. Calcified tissue takes which stain with hematoxylins and eosin stain? Options A, black. Options B, blue. Option C, pink. Options D, purple. The right answer is options B, that is blue. Calcified tissue takes blue color with that HNE stain, while calcified tissue takes black color with von Cosa silver nitrate stain. Okay. Questions number 30. Postmortem changes are rapid in options A, high environment temperature. Options B, large size of individuals. Option C, thick external insulations conditions. Or options D, all. The right answer is options D, all. That is a postmortem changes are rapid in following conditions. That is when there is a high environmental temperatures, when the size of that individuals who die is large. Okay. When there is a thick external insulations, at all condition that postmortem changes are rapid. Okay.